Hi, this is Professor Hale. I'm going to be covering or reteaching in exam 4 on a question on our exams, and this is mostly towards the autonomic dysreflexia review and spinal cord injury. So autonomic dysreflexia, it's an abnormal overreaction of the involuntary autonomic nervous system to stimulate. So as you can see right here, if you kind of break down the word, hyper means excessive or exaggerated. Reflex is response to some type. And autonomic is involuntary nervous system that controls functions that we can't do consciously. So in this video, I'm going to be reviewing just an overview of the sympathetic and the parasympathetic nervous system. If you want to have a better in-depth review of it, it's in your medical surgical book. So continue on to the parasympathetic. It is a rest and digest system. It's the vagal nerve stimulation occurs and it drops the heart rate in hopes of decreasing the blood pressure. But it doesn't work. Instead, the patient can become bradycardic. And vasodilation occurs above the site of the injury, but below the site of the injury, so which causes flushing above the site of the injury. So remember, normally vasodilation would help lower the blood pressure, but because of the spinal injury, the vasodilation can occur only above the site of injury, and vasoconstriction is still occurring below the site of the injury. So that when we look at the sympathetic nervous system, which is the flight or fight system, it saves our life when something bad occurs. So its functions is it constricts the blood vessels, which increases blood pressure, stimulates sweat glands, increases blood flow to the skeletal muscle for potential activity to react to dangerous stimulus, increase blood glucose for energy. It's the bronchodilation to help you breathe better. That way you can run to get out of danger or run from a bear. Increases heart rate, and it dilates the pupils for better vision. Causes is pretty much anything that is irritating stimulus below the spinal cord injury, preferably like if you can see we're T6 or higher. The three major causes of autonomic dysreflexia is bladder issues. Example would be a distended bladder or a urinary tract infection. Bowels issues like impaction, and breakdown of the skin, like any pressure ulcers or anything like that. So that creates those systems to go into overdrive and create the reaction. Spinal cord injury at T6 or higher spinal cord injury are at the highest risk. Always assess blood pressure and monitor for any increasing or elevation. If the patient reports a headache, you want to investigate by checking blood pressure immediately and then monitor. Also symptoms including throbbing headache, high blood pressure, flushing above the spinal injury site, which is the vasodilation, bradycardia. You will get the vasoconstriction with pale, cool, clammy skin, and this is below the spinal cord injury site. Goosebumps on the skin, sweating, dilations of pupils, blurred vision, and anxiety. And what to do if there's a medical emergency. You want to get help, call rapid response, and you want to stay with the patient. And if you notice any of those symptoms, you want to position the person in a high follower's position at a 90-degree angle with the legs lowered. This will cause the blood to pool in the lower extremities and help decrease the blood pressure. Check blood pressures every 2 to 5 minutes and remove any constricting clothing or devices of the patient. Make sure that, because that can cause that as well. Again, that's for prevention, the 3 B's. Remember that and you're golden. Bowel, bladder, and breakdown of skin. Bladder is to ensure the bladder is empty. You want to assess urine output. Bladder scan if bladder is not retaining urine. If it's retaining urine, scan the bladder. Prevention of UTIs. Ensure fully catheterized patent draining. There is no kink in the tubing, or if there's any blockage. Bowels, you want to make sure you want to do a thorough assessment. Palpate the abdomen, listen to bowel sounds. This is 101 physical assessment. Observe just if there's any distension, and if the patient is impacted, impaction is necessary. And then we have the breaking down of the skin, remove binding clothing or devices, turn and reposition every 2 hours, frequent skin assessment, and protect skin from any injury. And then here is the question the reason why I'm doing this video and reteaching. So the question is, a male client with a spinal cord injury is prone to experiencing automatic dysreflexia. The nurse would avoid which of the following measures to minimize the risk of reoccurrence? Strict adherence to bowel retaining program. That's actually something that you don't want to avoid. You want to keep going. You want to do, and keeping the linen wrinkle free to protect the skin. Make sure there's no disruption there. And prevention unnecessary pressure to the lower limbs. All those is something the nurse would not avoid. She would want to implement these interventions to minimize risk. And limiting the bladder for catheterization once every 12 hours. That is something that she would want to avoid. So you want to actually catheterize somebody 4 to 6 hours. You do not want to extend any longer than 6 hours. Just think about when you have to go to the bathroom, waiting 12 hours. I'm sure you're going to have a pretty full bladder. And this is something, especially somebody with spinal cord injury, should not be having. So always remember catheterization every 4 to 6 hours if indicated. And that is it on my reteach video.